Hello, my name's Julie McCrossin and welcome to this video for World Head and Neck Cancer Day 2024. And a big greeting to patients and family watching this, and of course to all the members of clinical teams and especially to nurses who play such a critical role in helping us to deal with every aspect of care. And I dedicate this video to my nurse coordinator when I was treated in 2013 for head and neck cancer, Susie Flynn, who works in Sydney, Australia. I want to highlight three key areas that we can improve to help head and neck cancer patients. Firstly, visual education before treatment. Secondly, the establishment of late effects clinics to help us with those long-term impacts of treatment. And finally, patient-reported outcome measures, or PROMS, being incorporated into routine care. So let's start with visual education. The only way I think we can really understand what we're in for with radiation therapy is if you show us visually what's going to happen. And so here's part of a video that I've made about the value of model LINACs, or radiation therapy machines, in patient education. Thank you, ladies and gentlemen, and everyone, for this opportunity to talk about radiation therapy from a patient perspective. My name's Julie McCrossin. Today, I want to ask you to do something to help prepare cancer patients and their families for the experience of being treated by radiation therapy. I want you to help make sure that before a patient is treated for the first time in a bunker with a radiation therapy machine, or LINAC, I want you to help me make sure that they see a model of a LINAC. Here is a model of a LINAC at St James Hospital in Leeds in the United Kingdom. It's a model that all children and young adults up to the age of 25 have the chance to see before their first radiation therapy treatment. And the purpose is obviously to educate and reduce anxiety. And here's a little LINAC kit that children with cancer at Leeds can use to build a little model LINAC before their treatment. Now, in Adelaide, in South Australia, there's a schoolboy called Connor who has designed and built a range of model LINACs. His grandmother was treated with radiation therapy and had to wear a mask, as I had to do when I was treated. And Connor has created these models to help educate and prepare people for the radiation therapy experience. And here's a scale model of the Varian proton therapy machine at the Proton Beam Therapy Centre at the Christie in the United Kingdom. Each child at the Christie who's going to get proton therapy receives a proton panda, and this little panda accompanies them through their treatment, and they get to see the panda on a little model proton therapy machine. People love medical models. Lego recently released and announced they were going to give away free Lego MRI scanner kits to reduce anxiety for children, and they're giving them away free to hospitals. And I posted a story on LinkedIn with a picture of one of these MRI models, and over 40,000 people have viewed it already. Medical models are commonly used in many areas of medicine, so patients can help to understand the treatment they're about to get. My mother and I were shown a model of a heart by her cardiologist, so we could understand what was going wrong with her heart. My friend was shown a model of a knee by her orthopaedic surgeon before she had knee surgery. My dentist showed me a model of a mouth before I got a crown. And my ear, nose and throat surgeon, who diagnosed my cancer, he has a model of a head in his clinical rooms so he can explain what he's going to do to people's heads. But for some reason, radiation oncologists do not use models to show cancer patients what radiation therapy involves. And you can help me change this by promoting the use of models in patient education for adults, teenagers and children, and by supplying accurate models of your LINACs to cancer centres to display in waiting rooms and to put onto the desks of radiation oncologists and other clinicians. The reason I'm so keen about visual education when it comes to cancer treatments like radiation therapy is because some patients can have a genuine shock, even a traumatic shock, when they first see and realise what treatment actually involves. Here's what my treatment was like back in 2013. Let me tell you now about the emotional or psychological challenge that I want your help with. I had never seen an immobilisation mask or a bunker. The first time I saw a mask was when I had my personal mask made, and I didn't understand. The first time I saw a LINAC was on my first day of treatment when I walked into my first bunker. When that mask was clicked down tightly for the first time, I panicked. I had to wear the mask for 20 minutes of treatment alone in the bunker for 33 consecutive days, and it was the hardest experience of my life. After 4 sessions, I went to my nurse and I said, I cannot go in there again. It is too traumatic to be restrained by the head. She immediately helped me. For the next 29 sessions, I had a low dose of Valium just before I went in to have my treatment. I played the same 4 songs during my treatment that helped me manage the time and calm me down. I also had a nurse come in and hold my hand while they clicked me into the mask a few times, and that was great. And I saw a cancer psychologist who gave me things to think about while I was in the mask. And with all this help, I finished the 33 sessions, and radiation therapy saved my life. So what would help a cancer patient to be ready for the emotional challenge of radiation therapy, and how can you help? Come with me now to St James University Hospital in the United Kingdom.
Hi, I'm Lucy, I'm the paediatric radiographer here, and this is our lovely baby LINAC. So what we can do is reproduce the patient's setup in Barbie mode. So we just need to push on the enable button, and then we can move around bed into position, and move the gantry around, move the floor around a bit, and then give Barbie some treatment.
Wow. And how do young patients and adult patients react to this? How does it help?
They love it. It's a really good tool to give them a hands-on experience of what it's like to be a radiographer, but also give them an insight of what it's like to have radiotherapy treatment without actually having to go into the clinical room. So without having to kind of invade on time on set on treatment machines, and also it's less daunting than going into the big machine, into this big environment. It's quite clinical. It's kind of fun thing to start off with as an introduction to radiotherapy.
Well, one of the interests of mine is how do you reduce anxiety and distress in both adult and child patients?
It's just, so we've got video on here as well, which is what's playing now, so we just got that. So it just as an introduction, it gets them familiar with the equipment, it gets them familiar with the materials of the mask. So the mask on Barbie is the same material that we use for the adult masks or the paediatric masks here now. It's the same carbon fibre couch top, same flooring, so it's all very similar to hopefully reduce the anxiety of what they're going to see when they go into a treatment room.
Okay, thank you so much. Thank you. Let me turn now to another thing we need to do to improve the lives of head and neck cancer patients. And I'm talking now about the need for late effects clinics as well as peer support. A couple of weeks ago, I travelled down to Essex in the United Kingdom to meet a survivor of mouth cancer called Karen. And here's part of the interview I conducted with her down in England. Well, here I am in Essex, in southern England. Can you tell us your name and the organisation that you've developed for people who've had mouth cancer?
Hiya, I'm Karen. I'm Karen Liesching-Schroder. I can't really say that very well. And I am a patient ambassador for the Mouth Cancer Foundation, which is a small charity in the UK.
And tell us what you do, Karen. I've been watching your work all the way from Australia, and so I've travelled here by train to meet you. Share with the head and neck cancer community what you're doing with your fellow patients.
Okay, well, I'm a survivor after 8 years of having tongue cancer surgery and radiotherapy. So I recognise the struggles that other patients go through with head and neck cancer. And the Mouth Cancer Foundation set up a weekly Zoom meeting for support for patients and family members in COVID, and it took off massively. It was very popular. It's a safe space to talk. And I co-host that with Jocelyn Harding, who is a dental hygienist and president-elect of the Mouth Cancer Foundation. And the foundation decided it might be an idea to have another type of support in the Mouth Cancer Foundation support group, which is a private group on Facebook, which I man for them. And we have professionals there, but it's the main component of it is for patients and family members from all around the world to be able to connect and talk in another safe space. And I make it a mission to connect with each person that posts within the group, help signpost them and show them they're not alone, because it's a very lonely and isolating cancer, and it's not talked about enough.
2 or 3 of the topics that come up again and again in your peer support work that you think are really tough for people who've had this cancer.
So initially you've got people going through diagnosis and surgery and treatment, which is tough going, so we support the patients through that. And then we've got the patients that are suffering afterwards with what is called late effects. Late effects can happen from 6 months, a year, and from there on. A lot of patients start noticing late effects from 5 years, some after 10, and they're finding it hard because there's not enough support out there. And that's another aspect that comes into it. And I don't want patients feeling alone with this. I know what it's like. I suffer. And it shouldn't just be a case of you've had your cancer, we've treated you for your cancer, on your way. It doesn't work like that, because we need quality of life, which is really, really important.
You're working with your local health service to try to get late effects clinics. Tell us what you're hoping to achieve and then some of the challenges you've discovered on this journey.
Okay, right. Well, there aren't enough late effects clinics around. There's only a few in the country, and hear amazing things about them. And I thought, I want one here where we live, in my hospital.
So where are you?
So my hospital is Southend University Hospital, and we haven't got a late effects clinic at the moment, but I am working closely with Nikki Wiles, who is head of radiotherapy physics, and some other professionals through the East of Essex Cancer Alliance, who are helping us, who have already got a late effects clinic, and are helping us get a pilot scheme together. It's not easy. A lot of it is about funding, the lack of funding, but it's also about education. I have been spending the last few months educating head and neck cancer professionals and GPs and primary care on what patients really need and the services that we need. It's really, really intricate, and a lot of professionals aren't aware. So I'm trying to build these different connections up in order to help the wider audience of head and neck cancer patients.
The third way we can improve the survival and the experience and quality of life for head and neck cancer patients is through PROMS, patient-reported outcome measures. And I recently interviewed 2 senior clinicians about PROMS and what they are.
So PROMS is a way of collecting patients' symptoms in a numerical score to give a clinician an idea as to what are the highest priorities for them or the highest, most burdensome symptoms that they might have. And they might ask, well, why do you need to measure it? Why not just ask me? And there are lots of studies that have shown that despite interactions between doctors and patients, doctors often misunderstand the importance of some symptoms over another. And so lots of studies have shown that the collection of PROMS actually improves the patient-doctor communication.
Okay, and Puma, how would you describe it? I always think it's worth hearing twice, and also why you're passionate about them, because I know you really are too.
I am, Julie. As Jeff said, patient-reported outcomes are direct reports from patients or their family members about their health status without any interpretation by other people, particularly clinicians. And patient-reported outcome measures, or PROMS, are the tools that we use to measure those outcomes, or patient-reported outcomes. You see, as clinicians, we've always sort of focused on survival, time to when disease progresses, or side effects as us clinicians would rate them. But traditionally, we haven't actually looked at the patient report as part of that process. Even though in the research setting in clinical trials for the past couple of decades, we've measured patient-reported outcome measures, patient-reported outcomes when we're comparing one treatment against the other. We want to see if one's better than the other in terms of controlling disease, and we looked to see if patients' quality of life, was okay and wasn't affected, and it wasn't a trade-off in the process of getting that extra benefit. But we haven't used PROMS in routine clinical care. It's only in the last probably decade or so, Jeff, jump in, that interest in really trying to look at incorporating patient-reported outcome measures as part of routine clinical care has become of interest to clinicians. And I guess that's come from recognition that to deliver truly patient-centered care and quality care, knowing patients' function and their quality of life is pivotal. And us clinicians may not be the best people to, we're not the best people to assess that. So we have to hear it from the patients themselves.
When I spoke to Puma Sundaresan and Jeff Delaney, I was keen to hear what they thought were the building blocks that have to be in place for patient-reported outcome measures to be effective and practically possible in the midst of a busy cancer clinic. And so here's Jeff Delaney's checklist for success.
So I think firstly we need a workplace culture that embraces PROMS as an important and essential part of clinical care. We need clinical champions on the ground who are leaders within that health service to champion the importance and to maintain the rage. We need an electronic system that allows patients to fill out the questions in their own time and the data to flow in real time, and to have an electronic system flagging those with high scores.
But flow in real time where?
Into the patient record. 4, a model of care with clear identification of the clinical staff responsible for actioning PROMS. And 5, a health system that recognises the benefits of PROMS, where adequate resources are allocated to the collection and action on PROMS.
Associate Professor Puma Sundaresan emphasises that the integration of patient-reported outcome measures into the electronic medical record is indeed absolutely crucial.
Integration with the electronic medical record, I think, has been the biggest barrier to many of us. And I think it's because cancer electronic medical records have been locked systems, closed systems for obvious safety reasons. But and we've had to work with the vendors very closely in order to create communication channels in and out of those locked systems. But integrating it is going to be the key. So working with vendors who provide the cancer EMR, so they're the same people who actually vendors for the machines, the LINACs. So, it has to be a team effort. It has to be a two-way process and can't be a commercial exercise where, they're hoping to sell new software that allows the collection of PROMS. It has to be to benefit patients. And has to involve clinicians. So I think that's a key thing. And my message to clinicians out there listening to this is start somewhere, start anywhere with whatever you've got. Because when you look at it, it is so big with so many barriers at the patient level, at the clinician level, at the health service level, that it all feels too hard. But start somewhere from wherever you're at, and you can build on it and improve on it.
Well, that brings us to the end of this special video for World Head and Neck Cancer Day 2024. If you'd like to watch all of these 3 videos that you've seen sections from in full, the links are in the info box on YouTube underneath this video. And thank you for taking an interest in head and neck cancer. My name's Julie McCrossin. I'll see you next time.